In this video, we'll discuss about Myasthenia gravis and Myasthenic syndrome. It is a group of disorder that have an underlying defect in the transmission of signal from nerve cell to muscles. So here, defect in transmission of signal from nerve cell to muscles. This disorder characterized by muscle weakness, additional syndrome affecting other organ system. So this disorder characterized by muscle weakness, additional symptom affecting other organ system. Transmitted by autosomal recessive inheritance. Myasthenia gravis and myasthenic syndrome both are acute autoimmune disorder characterized by defective neuromuscular transmission. However, these two diseases work on two different parts of neuron and also produce different effect. Myasthenia gravis produced antibody against post-synaptic membrane. This myasthenic syndrome produced antibody against pre-synaptic membrane. Gravis producing antibody against post-synaptic membrane. Syndrome produced antibody against pre-synaptic membrane. So this gravis antibody produced against Myasthenia gravis go and bind acetylcholine receptor, preventing acetylcholine from binding to its receptor and triggering muscle contraction. However, antibody produced in myasthenic syndrome work differently. They bind free synaptic voltage gated calcium channel. Here, antibody binding to voltage gated calcium channel and prevent release of acetylcholine because remember calcium triggers acetylcholine release. So we knows where the disease occur and how it causes damage. Now we want to discuss that clinical presentation. Myasthenia gravis started at eyes and moved downward. In more than half of the people who develop myasthenia gravis, their first symptom affect the eyes. The most common puncture ptosis, which means drooping of eyelid. Then diplopia occur around 70% of the patient. Diplopia refer to double vision. Then this myasthenic syndrome start at proximal lower limb and moves upward muscles, upward direction. Then in gravis, muscle weakness increases. Here muscle weakness increases with repetitive movement. So here muscle weakness increases during that movement. Here decreasing during repetitive movement. Then here deep tendon reflex are affected. Here absent. So here myasthenia gravis deep tendon reflex are affected. In myasthenic syndromes leads to absent deep tendon reflex. In myasthenia gravis does not causes autonomic disturbance, but here it leads to autonomic dysfunction such as dry mouth and impotence. It is important to do the CD chest to check any thymic hyperplasia or thymic gland tumor. In myasthenia gravis patient, as 2/3 of young people with 2/3 of young people with Myasthenia gravis have thymic hyperemia and about 1 in 10 have thymoma. 1 in 10 having thymoma. Similarly, it is important to do CD chest and X-ray for myasthenic syndrome as strongly associated with small cell lung carcinoma. Finally, treatment of these two conditions, if disease is due to thymic mass or along lung cancer, treat the cancer. Can treat myasthenia gravis with anticholinesterase therapy like pyritostigmine, immunosuppressant like corticosteroid, acetrophrine, and immunomodulatory agents such as IVIG and plasmapheresis. In this case of myasthenic syndrome, can treated with drugs like amifampridine and pyridoxicamine to improve muscle strength and immunosuppressant and immunomodulatory agent, just like we did in the treatment of myasthenia gravis and myasthenic syndrome. Here pyridoxicamine. So this is all about myasthenia gravis and myasthenic syndrome. Thanks for watching.